I'm Rick Buck and I've been a dentist for 15 years. Take a look at this tooth. It is so badly infected that it has spread into the palate behind the tooth. Can you see that little puffiness to it? So what's really interesting is when I numb the palate, you can see the infection starts to come out of the tooth itself. And so therefore you can tell that the infection is coming from this tooth, and this is rare what you're seeing here. Today, I'm going to show you more about the infection and how I pull out or extract this tooth. So subscribe if you have teeth. The first step to taking out a tooth is to get it numb. Now, that isn't so easy because the infection will interfere with the anesthetic that I'm using. You can see in the x-ray the dark oval shadow around the tips of the teeth. Those are the infections around the tooth. And you can see all that infection has eaten away into the bone and possibly even into the sinus as well. So teeth like this one that are badly infected are often difficult to profoundly get numb. Most times you can clear up the infection first by taking antibiotics beforehand, or even draining the infection by making a small little cut in the gums. Luckily, I can drain this infection simply by pressing on the gums themselves. So you can see here, every time I press on the infection on the palate, blood mixed with infection are coming out of the tooth as well. This is pretty crazy. I mean, this is one of the few times I've seen anything like this. Most times you can drain the infection by making an incision in the gums. But today I'm actually not gonna have to do that because I can tell that the patient is sufficiently numb by just doing the normal numbing process. So now let's move on to extracting the tooth, and we need to start by loosening the tooth. We do this by putting a lot of pressure on the tooth with this instrument called an elevator. An elevator can basically slide between the teeth and the surrounding bone and use it as leverage for prying pressure on the tooth. The more pressure that goes on the tooth over time, the more you can see it start to slowly move. And what is happening is that the ligaments holding the tooth in place are stretching and slowly breaking. The bone around the tooth is also slightly expanding. So the more pressure that's on it, the more ligaments break. The more ligaments that break, the more the bone expands. The more the bone expands, the more ligaments break, until it just becomes looser and looser. And then the looser the tooth becomes, the more my instrument also rotates. Now you can see with this instrument, the more it rotates, the more the pressure of the tooth, instead of going lateral, is pushing the tooth upward and out of the socket. So it's an exponential process. The more you get it to move, the more it will continue moving. Now, once I get the tooth loose enough, and you can see here now that it's pretty loose, I use forceps to extract the tooth. Now the forceps do two things. Not only do they grab the tooth, but also the more you close them, the further they slide under the tooth, putting pressure upward and out of the socket. Now, if you want to know my technique here, it's basically I'm putting pressure back and forth on the tooth for about 10 seconds at a time and feeling for those ligaments to start to break free as the tooth gets more mobile. And if you pay close attention, you can see as I switch the direction of the force on those forceps, the tooth is moving more and more. And once again, those ligaments are just stretching and breaking, and the bone is expanding. Now here, once I get to a certain point, you can see some infections start to squirt out of the top of the tooth. And it keeps doing it the looser the tooth gets. And likely that's because the tooth is putting pressure on the infection and pushing the infection out of the tooth. And as I keep saying, every back and forth motion, it becomes looser and looser, and the tooth is about to come out until finally it pops out. Now, after the tooth is out, I have some more important things to show you so that the socket will heal well. Quickly, my favorite toothbrush, floss, and other dental products by far are in Amazon affiliate links in the description below this video. Those dental products will give you stunning results every time you clean your mouth. And you can also watch my video posted at the end of this video to see why they are the best and how to brush and floss your teeth with immaculate results. Now, once the tooth is out, I want to first look into the socket to see how aggressive I can be in cleaning out the remaining infection. To do that, I'm also looking for little air bubbles in the blood, which would indicate that the infection was so bad that it also made a hole into the sinus. And if it made a hole in the sinus, your air, when you breathe, would create little bubbles in the blood. Looking back at the x-ray from earlier, this ambiguous line here is the floor of the sinus, and sometimes there is a hole left in it after taking out a tooth, especially if there was a bad infection. Now this is kind of cool because here I don't actually see any air bubbles, but I feel like I can see this gray lining at the bottom of the socket. And that gray lining is likely the sinus membrane. So that infection likely ate away at the bone, but not all the way through the sinus membrane. What that tells me for today is I'm going to be very careful cleaning out this socket so I'm not going to puncture that membrane and make a hole in the sinus. So to clean out the infection then, I'm going to take this spoon instrument that I have and carefully scrape the linings of the socket, making sure to avoid that membrane. And here you can immediately see that I'm pulling out infection. I'm going to keep doing that and pulling out infection and trying to get out the granulation tissue left behind by the infection. Granulation tissue is basically scar tissue that is unorganized and filled with inflammatory cells, and that granulation tissue also becomes easily infected. So we want to remove as much of it as possible. Now, we try to remove most of this infection, but the infection would likely go away on its own anyway, even if we left it behind. The tooth is the source of all this infection, so when the tooth is gone, the infection dies too. In other words, when the source of the infection is gone, most of the time the infection will also go away. And your body will take care of this because it will also break up all that granulation tissue once the tooth is out as well. But to be on the safe side, I always rinse the socket with ozonated water, which kills bacteria, flushes the socket out, and has been shown in published studies to likely reduce the pain after an extraction as well. Now, because the socket has exposed the sinus membrane, I will put a resorbable membrane that will promote clotting to protect the socket as well, and that sinus membrane, I should add. Now, this membrane that I'm using will be dissolved on its own by the body, but not before it creates an amazing clot in the socket. Now, I bet you're dying to see a little more of that granulation tissue connected to the tooth. Before I show you that granulation tissue attached to the tooth that came out, I suture the socket closed. I'm not sure suturing the socket is necessary in this case, but it will help the clot stay in place for the healing of the socket. And now that I'm pulling tight this suture, this is what it looks like when we're done. Now, one addition here, if we were going to do an implant, I would have also filled this socket with bone graft, and I'll show you that bone graft procedure in another video. So now going back, here's the tooth we extracted, and what I'm playing with here is some of the infected granulation tissue that stuck to the tooth even after I pulled it out. Sometimes this tissue is very large and stuck to the tooth, and then sometimes it's small and doesn't even stick to the tooth. So we got a little bit lucky here today. Now, not all of you, but many of you arrived at this point because of a lack of adequate hygiene, and you may not even realize it with the way you're brushing and flossing. Watch my daily dental care video I have posted now for the best technique, tips, and product recommendations for a stunningly clean mouth that avoids tooth decay, gum disease, and gives you fresh breath. The best dental products that I recommend are in Amazon affiliate links in the description below. If in Southern California, my dental office is in the description as well. Like and subscribe to my channel if you have teeth.